Using regular yoga practice to reduce blood pressure in patients with unmedicated prehypertension by Victoria Weber. Hypertension is an epidemic in our society, and the current treatment protocols are not adequately addressing the problem. There is mounting evidence in the literature to suggest that regular yoga practice could lower blood pressure and ease this significant morbidity. The question is, can we implement an evidence-based practice solution for using yoga to lower blood pressure in patients with prehypertension before it progresses to hypertension? Here is the magnitude of the problem. According to the Centers for Disease Control and Prevention, in 2013, 67 million American adults, that is 31%, have hypertension. In addition to that, another 30% of adults have prehypertension. That means that over 60% of adults in America have high blood pressure. In 2009, 348,000 deaths in America listed high blood pressure as a primary or contributing cause. Moreover, as nurses, we know that high blood pressure contributes to heart attacks, strokes, and chronic heart failure. Aside from the human costs involved with this epidemic, there is also a significant monetary cost involved. The American Heart Association reports that high blood pressure costs our nation $51 billion annually in direct medical expenses and lost productivity. This number is expected to increase to $343 billion by 2030. Obviously, we have a major problem to address. Although there are many prescription medications available to treat hypertension, the problem continues to intensify. Current drug therapies for hypertension are not effective simply because patients are not adhering to their medication regimens. The CDC revealed in 2013 that only 47% of people with high blood pressure have their condition under control. In a 2012 research study published in the Journal of Vascular Nursing, it was found that 57.9% of patients did not use their medications as prescribed. We know that hypertension is a disease that is increasing in prevalence, and we know that the current solutions are not effective. So, could yoga be the answer? Here's what the research says. In a 2013 meta-analysis and systematic review published in Evidence-Based Complementary and Alternative Medicine, researchers compared 17 controlled studies on patients with hypertension or prehypertension. The results showed that yoga practices that include the three basic elements of yoga, which are postures, breathing techniques, and meditation, had a dramatic effect on blood pressure. Reductions of 8.17 millimeters of mercury in systolic blood pressure and 6.14 in diastolic blood pressure were seen when the three basic tenets were included. Another study, this one a randomized controlled trial published in January of 2014, was conducted to compare the effects of yoga and non-aerobic exercise in adults with prehypertension and hypertension. Like the studies in the previous meta-analysis, the yoga practice in this randomized controlled trial incorporated postures, breath control, and meditation. In both the yoga arm and the active control, the participants completed 3 55-minute classes per week for 6 to 8 weeks. The results showed that the yoga practice decreased systolic and diastolic blood pressure by 5 and 4 millimeters of mercury respectively, while the non-aerobic exercise arm showed no decrease in blood pressure. In addition, 2 more recent randomized controlled trials showed the effect of yoga for prehypertension versus, in one study, progressive muscle relaxation, and in the other study, dietary changes. Both studies found yoga to be effective. The yoga intervention performed versus progressive muscle relaxation used meditation and postures and showed a decrease in both systolic and diastolic blood pressure. The progressive muscle relaxation showed an increase in diastolic blood pressure. Similar results were found with the yoga performed in the study versus diet changes. The researchers saw that the yoga practice, which included postures, breath control, and meditation, showed comparable results to dietary changes for weight reduction. The research studies clearly show that yoga has a positive effect on blood pressure levels. Also, it is important to recognize the role of yoga in the current society. Americans are recognizing the benefits of regular mindfulness practice. The number of yoga practitioners continues to rise, with current estimates indicating that at least 15.8 million people in the U.S. practice yoga. Americans realize that yoga is effective, simple, and inexpensive. Yoga requires very little, if any, equipment and can be done at any time, anywhere. Although it should be noted that there is no clear consensus for the length of yoga practice, we can see from the literature that postures, breath control, and meditation are the key elements. An evidence-based solution to reducing blood pressure in unmedicated patients with prehypertension would be to implement regular yoga practice incorporating those three tenets. Knowing the results of the studies, the magnitude of the hypertension epidemic, and the cost of hypertension contrasted with the cost of yoga, a recommendation for best practice can easily be made.